Hi and welcome to our telehealth medicine information video. I'm Garvin and this video is on Vitafen. So what is Vitafen used for? It's used for reducing pain and inflammation in rheumatoid arthritis, osteoarthritis, and a form of arthritis that affects the joints in the spine called ankylosing spondylitis. So how does it work? Vitafen or Aceclofenac tablets contain the active ingredient Aceclofenac. So this is a type of a medicine called a non-steroidal anti-inflammatory drug, or an NSAID. So NSAIDs are used to relieve pain and inflammation. Vitafen works by blocking the action of a substance in the body called cyclooxygenase, or COX, COX. Cyclooxygenase is involved in the production of various chemicals in the body, some of which are known as prostaglandins. Prostaglandins are produced by the body in response to injury and certain diseases and conditions and cause pain, swelling and inflammation. Vitafen blocks the production of these prostaglandins and is therefore effective at reducing inflammation and pain. So how do you take Vitafen? The usual dose of Vitafen for adults is 100mg tablet taken twice a day, morning and evening. The tablets should be swallowed whole with a drink of water. They should preferably be taken with or after food, and try and space your doses evenly. Even if you forget to take a dose at your usual time, take it as soon as you remember, unless it is nearly time for your next dose. In this case, leave out the forgotten dose and take the next dose as usual. Do not take a double dose to make up for an earlier missed dose. So a key point in Vitafen: this medicine may mask the symptoms and signs of infection such as fever and inflammation. So this may make you think mistakenly that an infection is getting better when it isn't, or that an infection is less serious than it is. For this reason, you should tell your doctor if you get an infection while you are taking this medicine. Your doctor will prescribe you the lowest effective dose of this medicine for the shortest possible time necessary to relieve your symptoms. This is to minimize the chances of any side effects. So Vitafen is to be used with caution in elderly people, people with a history of disorders affecting the stomach or intestines, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, kidney disease, liver disease, high blood pressure or hypertension, people with raised levels of fats such as cholesterol in the blood, and diabetes, people who smoke, people with blood clotting problems, or taking anticoagulant medicines. Also used with caution with people with a history of asthma or people with a history of allergies and diseases affecting connective tissue such as lupus. Vitafen is not to be used in people in whom aspirin or other NSAIDs, for example diclofenac, cause allergic reactions such as asthma attacks, itchy rash, nasal inflammation or swelling of the lips, tongue and throat. People with an active peptic ulcer, perforation or bleeding of the gut. It's also not to be used in people who have a recurrent peptic ulcers or bleeding from the gut, 2 or more episodes, and people who have previously experienced bleeding or perforation of the gut as a result of taking an NSAID. It's also not to be used with people with heart failure, people with heart disease caused by inadequate blood flow to the heart, for example angina. Also severe liver failure, severe kidney failure, and not to be used in the 3rd trimester of pregnancy. Also hereditary blood disorders called porphyrias. This medicine is not recommended for children and adolescents under 18 years of age. The medicine should not be used if you're allergic to any of its ingredients. So regarding pregnancy and breastfeeding, this medicine should not be taken in the 3rd trimester of pregnancy because it may delay labour, increase the length of labour and cause complications in the newborn baby. It is not recommended for use in the 1st and 2nd trimesters of pregnancy unless considered essential by a doctor. Some evidence suggests that NSAIDs, such as this one, should also be avoided by women attempting to conceive, as they may temporarily reduce female fertility during treatment and may also increase the risk of miscarriage or malformations. So you need to get further medical advice from your doctor if this relates to you. The safety of this medicine for use during breastfeeding has not been established. So the manufacturer recommends that this medicine should be avoided where possible by women who are breastfeeding. So it is important to get appropriate medical advice from your doctor before taking this medicine if you're breastfeeding. Some of the main side effects of Vitafen would be dizziness, disturbance of the gut such as diarrhea, nausea, indigestion or abdominal pain, alteration in results of liver function tests, flatulence, constipation, vomiting, mouth ulcers, inflammation of the stomach, skin reactions such as itching, rash and dermatitis, increased creatinine and urea in the blood, decrease in the number of red blood cells in the blood, which is anemia, hypersensitivity reactions such as narrowing of the airways, swelling of the lips, throat and thumb, itchy, blistering rash or anaphylactic shock, visual disturbances, shortness of breath, ulceration or bleeding in the gut, dark coloured tarry stools due to the presence of blood altered by the intestinal juices, and heart failure. So the side effects I've just mentioned may not include all the side effects reported by the medicine's manufacturer. For more information about any other risk or possible side effects associated with this medicine, you need to read the patient information leaflet provided with the medicine or talk to your doctor or pharmacist for more. How can this medicine, Vitafen, affect other medicines? Vitafen should not be used in combination with painkilling doses of aspirin or any other NSAID taken by mouth, such as ibuprofen, diclofenac, naproxen, as this increases the risk of side effects in the stomach and intestines. Selective inhibitors of cyclooxygenase 2, such as celecoxib or etoxib, should also be avoided for the same reason. So they're ATOC or acoxia. There may be an increased risk of ulceration or bleeding in the gut if Vitafen is taken with corticosteroids such as prednisolone. There may be an increased risk of bleeding if Vitafen is taken with the following medicines. So anti-blood clotting or anticoagulant medicines such as warfarin, dabigatran, apixaban, rivaroxaban, heparin, antiplatelet medicines to reduce the risk of blood clots or thin the blood, such as low-dose aspirin, clopidogrel, dipyrimidine, and iloprost. Selective serotonin reuptake inhibitors, antidepressants such as fluvoxamine or fluoxetine, paroxetine, citalopram and venlafaxine. If this medicine is used in combination with quinolone antibiotics such as ciprofloxacin or norfloxacin, there may be an increased risk of seizures. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and